So what to expect during your floor month? In this video, I will show you how your day will look like. A day before your rotation, an email will be sent to all the team members with a time and a place to meet. Your rotation will be mostly between the 4th and the 5th floor, possibly ER or Transitional Care Unit in Detroit Receiving Hospital. You will need an orientation about the hospital layout, including Detroit Receiving, Harper, Germanos, and VA. This is a simple layout of Detroit Receiving Hospital. The way of contact between you and other team members can be through a group of texts or the paging system. No patient names, numbers, or identifying information should be shared using the group texting. Pre-round. Your day will start before 7 a.m. with the pre-round, which is everything you do before meeting with the team on the round. Start with checking the list of the patients you will be covering, getting the sign-out from the night team, chatting with the nurse about how the patient did overnight, review the patient nighttime vitals, imaging, labs, and consultation. After that, head to the patient room. For established patients, take history and conduct focused physical examination on the main problem that happened overnight. Then make sure to document your findings. However, for all new patients, you will have to take a detailed history and do proper physical examination. Always take your own history, don't depend on other people's history and physical documentation. When trying to conduct your physical examination, try to undress the patient if possible. Performing a cloth-on physical examination will result in a low-yield findings. Try to perform fundoscopic exam on a new patient and a basic neurological exam, cranial nerve, deep tendon reflexes, and strength. Bandages are to be uncovered unless they are post-surgical and the surgical team hasn't yet changed the dressing. Look at every line, tube on every patient every day. Always assess its necessity and document on your progress notes. If your patient cannot speak for themselves, you might need to call nursing home or a family member. The patient primary care needs to be contacted upon admission and discharge. Moreover, you have to review primary data. This means look at ground stains, review peripheral smears, examine urine sediments, and sometimes you have to discuss radiology report with the radiologist. Your senior resident will help you find all of these places, so don't worry. Always make sure you have a plan for the patient: staying, leaving to home, subacute rehab, shelter. If you are planning to discharge the patient and you don't have a discharging place, you should talk to the social worker. The case manager will help you getting medication pre-approval. Always check with the senior which one you should contact. Furthermore, you have to address the CODA status. Obviously, you don't need to have a lengthy discussion with a 25-year-old admitted with a cellulitis. The patient with a life expectancy of fewer than 6 months or with a history of cancer or terminal ill patient, you should discuss CODA status, full code, DNR, DNI, after discussing the plan with the senior. The round. The round will involve meeting with the round team. The team usually include the attending physician, senior resident, an intern, medical student, pharmacist, and a pharmacy student. The attending will physically round on each patient. You have to present your patient systematically, so make sure you know your patients well. You'll be expected to develop a plan for each of your patients, and the attending will discuss and modify your plan accordingly. The plan will include reviewing the patient treatment, placing new orders, contacting consultant, social worker, case manager, patient family members, and going back to reevaluate the patient if needed. At the end, you will run the list with the attending. which basically means recapping the patient plan of care. Post-round. After finishing the round, you'll go to the morning report around 11 a.m., where are you going to have an integrated case discussion. It will be held in 2E. Sometimes you'll finish prior to the morning report. Try to finish some of the work or some of your notes during that time. Later, you will return to the floors to execute the patient care plan that was discussed in the rounds. That include entering the patient orders using electronic medical record (EMR), start paging, calling or texting other healthcare members, and finishing your notes. The sign-out. You'll have to sign out your patient to the on-call team. That means make sure to include all the do and the do not for the patient. Any lab imaging need a follow-up should be addressed, and inform the call team if any patient needs special attention. At the end of the day, your team will meet, talk about the plan for the next day. Leaving the hospital. Eyeball all your patient at the end of the day. You'll be expected to leave the hospital around the 5 p.m. after finishing all the patient required work. Assign day off and weekend. Describe how the weekend will be handled. Some attending might ask you to read assignments and present them during your rotation. Study every day. Use your patient case to inspire you. It doesn't have to be long, but otherwise you won't grow.